Hi everybody, I'm Dr. Qazi. I'm a skin restoration specialist in Newport Beach, California. I focus mostly on acne and scars and pigmentation. I do a lot with facial balancing and collagen stimulation as well. This is a really cool case. It's a patient who wanted to get as close to glass skin as possible, really just get the best possible result. And over the course of a year here, I started working on him in June of last year, and we've done a few sessions. He comes all the way from Arizona, and we were able to really get this amazing improvement over here for his skin. It's pretty close to scarless, actually, pretty close. There's little tiny little bits that are still left, but it's pretty close. So a lot of people ask, is it possible to get to kind of close to scarless as much as we can? And here you have an example of that, really, where you could see pretty clearly that we're like right there, right on the cusp there. So it's pretty cool. I mean, this is one of those cases that this is a guy who really just wanted to do the best, and he also just kept on doing everything that I told him to do and followed everything I told him to do, and just we ultimately were able to achieve the look that he's trying to get to. And again, 1 year later, improvement over here. It did take several steps, so this is not just a single step, because these are boxcar scars. They do take several sessions for these kind. It's definitely not a one and done type of treatment for boxcar scars like this, but it's awesome because here we are, 1 year later, and it's a good collagen response. I mean, he's 22 years old, so he did have a nice, robust collagen response. He's otherwise fit and lean and healthy. Doesn't smoke, stays really like clean with his lifestyle. And sometimes he comes on here. Actually, one time I shared one of his early results, and he said, "Hey, it's me." So it's every once in a while he's on here. I don't know if you're on here tonight, but yeah, look how cool this is right now. This is a really awesome, cool result of somebody that essentially really had done a lot of things and done a lot of research, and found that there was not much that he was getting, much improvement that he was getting. So just kind of wanted to get more confidence and feel better about himself without wasting money and putting money down the drain, really. And I remember just during this whole course of time that he just whatever I was saying to do, he was like, okay, let's do it, let's get it done. And we got it. It's like, there we go. Here's almost like complete perfection in my mind. I don't know, you guys, sometimes everyone always asks what's the percentage change, but to me it's pretty close right there. I don't know, and to him it is too. So I'm going to catch up on some of these questions that are coming in here. Do you have an Erbium laser? Yeah, I use the Erbium laser a lot. That's actually one of my favorite lasers. I used a bit of that for this patient, actually. So I use it more for blending purposes, not so much of just the actual scar portion of things. Hang on a second, my thing got tangled up there. All right, perfect. So yeah, I use the Erbium more for just polishing and just cleaning up a little bit there. Hi Sailor Moon, how's it going? Did this patient need subcision? Yes, we did do subcision for this patient. We actually did about 5 sessions total for this patient, not of the same thing, but we did about 5 sessions total for him to get there. We did TCA Cross about 5 times. We did Bellafill as well. We also did some laser resurfacing. We did that about 3 times actually for this patient. So subcision, though, we just did 1 time for him. So it was awesome. We got that really, really close. Price of the 5 sessions, I can't say what individual patients pay, but just for privacy reasons here, but I could say most patients $5,000 to $7,000. This patient required quite a bit of volume replacement, so that is going to push it up. If I had to estimate, it could be anywhere between $10,000 to maybe $15,000 sometimes. Maybe for him a little bit less because he didn't have too much volume loss, but sometimes it could take that much for the amount of volume we have to put in there. Hi, how I'm up is saying, what's up, doctor? Looking forward to seeing you in a week. Good to see you on here too. You've been on here for a while, so look forward to it. Look forward to helping you out really, really well. Mo always saying, what's the recovery time of ND YAG laser? I usually don't use just the ND YAG laser for things like this. I don't really do it that way, actually. I do it more for just veins, and I don't really touch it for other purposes, actually. I don't think it's a technology that I don't think is the best for resurfacing. There's a lot of better options, actually. What's a rough estimated cost? So yeah, most patients $5,000 to $7,000. This patient wanted to get more of that fully polished look, wanted to get it as close to the best possible skin he could possibly get. and that could cost more, and then we had to do a little bit more for volume replacement for him as well. His he's 22 years old, but his scars did destroy some of that fat right there in the lateral cheek, mid cheek area too, but we had to restore that. So it took a few steps really to get there. Actually, I do have some of his selfies. You can see, take a look at this. It's that same side. This is what he had submitted while he was healing. So this was not just a one time though that we did it, but you can see kind of the pattern of some of the more intensity that I worked at. And that's why it's got so smooth over time. This is a nice, hopefully you guys could all see that there. But yeah, this is like a nice way of just kind of seeing what I just showed you, so you could kind of map it out, kind of what I did. It was a little bit more intense than like those lateral cheeks. We did do some volume over there. Initially, the first time I did it, I did do some subcision as well. And I did do ablative CO2 laser for a lot of the edges of these scars, which worked out really well for him too. So you can see this is, kind of a really nice way of looking at it. I wanted to show this because it does go to show also that it's not true that you have to just like bulk heat the skin. I have so many patients who say that, they've done laser before and it was just like really like crazy intense what the healing and recovery process was. And I don't believe in doing it that way, especially for scars. For like aging purposes, it's different. If it's like fine lines, wrinkles, laxity, we want to tighten the skin, those type of things, then of course we could work on that, like with a full face. But for patients who are acne scar patients, we could actually do it this way. We could do it where it's like more localized and then like a lighter blended approach everywhere else. How long did these results take? This is over the course of 1 year for this patient. So this is a 1 year result. When he came in this day in March, so a couple months ago, I ended up doing actually a little bit more TCA Cross and then a little bit of Bellafill there. So I did a little bit more there, and then it's going to be even better. Actually, I just followed up with him. I just remembered, that's why I put this up here, because I just followed up with him a couple days ago, and he's like looking amazing. It's so smooth right now, so smooth. So his results are going to be even better, actually. And it's like, if that's like, look how smooth that is. And again, it's like some people want like that really polished look. They're trying to shoot for that polished look. And this was over the course of a year. Somebody who like followed exactly what I needed to do. He's just a wonderful patient, and did exactly what I said to do, and he did it, and we achieved the look he's trying to go for in life. And it's just like, it's crazy like that. Something like this, someone else would have just done nonsense treatments on him, and they were doing nonsense treatments. And it's like, I want everybody to know that there's a way to do this properly. There's a way to do this. We could do this over and over and over and over again. Just follow what I say and we'll get you there. It's like, that's what I always tell people. We'll follow what I say, we'll get you there. Thoughts on microneedling for light scarring? It depends on the kind of scars. Like this patient did do, like some people would say these are light scars and it didn't work, so it's like, it ends up just being a waste of money then. So it's like, I could see for like pretty mild scarring, it's okay. But personally, I don't think that there's much utility to it. It's not really beneficial because of the cost, the downtime, not really too worth it for patients. I'm up is saying, what will be the recovery time for the combination treatment so I know how long I'll be missing school? That's going to be about mostly about 4 to 7 days for the vast majority of patients there. Let's see here. Yiha Ma is saying, hi, Dr. Qazi. I've done 3 subcisions and the improvement is observable. The improvement in the temple area is the least. I'm wondering, what is your take on improving rolling scars in the temple? Good question, actually. So really the temple area typically doesn't have these really thick tethered bonds as much as other areas of the face. It's pretty easy. Vast majority of times, it's very easy for me to break that up. And it's not going to solve it. It's not going to solve the thing. The bigger problem is actually typically more along with the volume loss in the temples. So you have to do volume. Sculptra could work really, really well. I'm not sure what your location is, but like Bellafill, Sculptra, those are great options actually for that. I would not really be pushing much with, more like laser and like more things like that are more resurfacing for the temple area. Like light resurfacing, it's okay. I don't know how thick your scars are, maybe a little bit more, but vast majority of the time you have to do volume replacement. Like you start losing volume in your temples pretty quickly. Just anybody who works out or is like active, it's really quick and easy for that. Tichin is saying, hi, Dr. Qazi, question regarding my phase 2 treatment. I'm a little bit worried about doing laser during the summer due to sun exposure with some of my plants. Is it possible to do TCA Cross only first? Yeah, sure. Yeah, the more TCA Cross we do, the better. I'll tell you honestly, summertime is one of our busiest times though, because actually like patients like this who are in school, they come to us all the time during the summertime. Like that's actually like one of the busiest times for us. So like between high school and college, and then in between university time, in the summertime, really busy time for us actually. So spring break, summer, really busy time. And we don't run into pigmentation issues because people just, actually, interestingly enough, I mean, I feel like I maybe wouldn't have been as good of a patient as a lot of my college patients and like high school kids, but like they're really good with sun exposure actually, and like really good, like they listen about, like this patient listened, like he lives in Arizona, and he's somebody who just like followed exactly to a T, like what I said with sunblock, everything, just like did everything properly. And it was like I just fully trusted that we could get this. If you feel like you are getting more sun exposure, then sure, we could change the treatment pathway. You know better than I do about how much sun exposure you're going to get. But I'm just saying though that, like, interestingly enough, actually it's really busy during the summer, and we don't run into problems actually. And people tend to be actually better than I probably would have been, which is awesome. So it's like I get to actually kind of showcase these awesome results over and over again. Jack Batista saying, hey, Dr. Qazi, does using the COT laser for thicker scar edges reduce shadows around scars? Yes, if it's like the real thickness around there, then yes, it is. Keep It Zen is saying, thanks for the recommendation on the visor. I got it. Awesome. Yeah, you guys are all going to know who my patients are. We're going to be walking around with visors. You're going to see me around. Some of you guys do see me around walking around town, actually, with the visor. It's like how I do it because I just don't want any sun exposure. I want to keep it so I have no pigmentation, hyperpigmentation, I should say. I like the natural skin tone, but I just don't want to get burned or anything like that. Let's see. Joanna saying, I have small bony growths called miliary osteomas. Are you familiar with this condition? Yes, you would try to burn those down, actually drill a hole in there and squeeze it out. So actually, it's pretty interesting. Actually, I do that. Sorry that you have that, though, but that is something that we could work on now. Drill a hole, pull it out there. You can get that out there, actually. And actually, you can map it out with the ultrasound, actually, too, interestingly enough. So you could map it out, actually, and take a look and see where each lesion is, and then potentially actually just like really just go really precisely with that. Do rolling scars and Bhaskar scars need volume? Sometimes, not always. Sometimes they do. So Gabe is asking, when will my collagen build up again? Did 2 sessions so far. Gabe looks awesome, actually. I'm going to actually show Gabe, should I show your results? Because I feel like people should understand what's going on with Gabe and how good his skin is. Gabe does not, let's see here. Let's show Gabe. Gabe had a little bit of some areas where he wanted to improve like some of his skin texture. He wanted to improve some of his scarring in the temples. And I'll show you where we are at with Gabe. And Gabe, I gotta tell you, your progress is awesome, and it's going to continue to be awesome. And I know that you're trying to get closer to this kind of patient, but we only did 2 sessions on you. This patient we did 5 sessions, so it's like it ends up taking a lot more work sometimes. But look at how polished it already is, Gabe. Let's see, where are we at? Here we go. So it was, I think it's awesome, like where we are already. Let's see, it's pretty smooth here. It's pretty smooth, it's like, look at that. So you're almost there. I mean, I would say there's just like little bits of like Bellafill, things like that. But Bellafill goes down and then it goes up again. So remember we were talking about that, and we were talking about how to do more Bellafill down the line, just for those temple areas. But look at that. I mean, that's like, it's pretty smooth right here. I know it's kind of hard to see on this kind of screen, but yeah, pretty good. So I would say your scarring, like, a lot of that's been solved. It's just that a little bits of like these, like a little bit more room for some Bellafill in some of the temple area there, but pretty good. So I'll show you. Yeah, what do you guys think of Gabe over here? Gabe's results over here. How do you treat out of town patients that maybe can't do 5 sessions? Well, we can still do we still get excellent results. It's just that sometimes people want more of that polished look. Like Gabe wants more of the polished look. He wants it like completely smooth. He even says he wants glass skin, and maybe we're getting pretty close to it, but like I don't know, but if it's possible or not. He's following the instructions. We are doing a lot of things for it, yeah. So Gabe's saying he wants glass skin. He wants really, really smooth glass skin, and maybe ultimately we'll end up getting there. but it's pretty close to it though. Look at that. Like it's pretty close. So that's pretty cool. And the patient above, and he comes on sometimes, and he's like pretty close to it. And he did 5 sessions there. So he did 5 sessions there of that. And we did it over the course of a year. And, you want more of that fully polished look. That's kind of what to, it takes that long. And it's like, that's like, it's not going to be able to be rushed. It's not going to be able to be like something, in just 1 or 2 sessions sometimes for some of these people that want like fully polished, like really, really smooth look. I mean, it may not even be possible in everybody. It's just like we try our best. We could do things that we could try to get to. But sometimes it's like, this patient I'm showing right now, he's 22 years old. And we started the process when he was 21 years old. So it's like there's a whole journey with this whole process here. Is this subcision with Bellafill? Yes, this was subcision with Bellafill, correct. And I'll show you someone else actually too. And this is somebody who did multiple sessions too, actually. So she also wanted like more of a polish. Like, let me see if I can find her on my thing, if I still have it here on this list of things. But yeah, I mean, it just depends on what people are trying to shoot for. It's like, how smooth are you shooting for? And you can kind of think in your mind what you're trying to go for. People like are happy just with like, okay, like where it was and where it's at. Like maybe you don't need to do much more in life. Like that's all we have to do. We don't have to do that much more now. And it's like, do you really need to do much more? Or is it like, just that like you find that you're trying to achieve something and you're trying to do it in a too soon of a manner. It takes a year. It took a year for this patient who's 22 years old. It could take like a year and a half to 2 years for patients who are a little bit older. And he's a patient who's fit, super fit, otherwise very, very healthy patient. And for him, it's like, we're able to get there. This is a patient, she comes on all the time too. She's somebody who wanted that fully polished look. I now just only really just treat her rosacea, just mild a little bit. And she did that. Now she's done about 6 or so sessions now. So it's like, ultimately it took a long time to do it. And we did lower heat, lower energy sessions for this. And it took a while to get to that, to get that skin to soften up like that. And this is for her, it was over the course of, I've been seeing her for almost 3 years now. And I just saw her again last week or so. It's still super smooth, super polished. And that's just the look that she wants. So she just does it like kind of the way I do it and some other patients do it. They just want like lower heat, lower energy laser, like just like a kind of like 2-3 days of recovery. Patients tell me, they're like, can you just do a 2 days recovery, 4 days recovery? Sure. And that's all we have to do sometimes. We don't have to do too much more with that. But I'll go back to this, the patient. Hopefully you guys all see this one here. But yeah, this is kind of giving you a good idea. You do not steer us wrong. Thank you. Yes, I appreciate you. Visible improvement. Congrats so far, Gabe. Yes, exactly. How do I get rid of horizontal stomach lines? I'm not overweight. Well, that may be tough because if there's loose skin, you may not be able to. It's you maybe have to lose the skin itself. It doesn't have to be overweight, but you may have to lose that. Sachin saying anti-aging treatment suggestion. So depends on what your age is and what you're trying to achieve. Easiest thing to do is start a retinoid. That's like the easiest thing to do is an anti-aging purpose. Like that's the best thing to do. What do you think of Radiesse for acne scars? I just did some today for acne scars. It work really well. It just depends on the kind of scar tissue that's there. If there's a little bit of laxity, I want to stimulate more elastin production and get it so that's a little bit more firm there. That's sometimes what I would use. But otherwise, I use a lot of Sculptra. I use a lot of Bellafill. Let's see here. Yihei Ma is saying, I'm in the Bay Area. We'll contact you later. Appreciate your content. Appreciate you too. So yeah, Bellafill will work really well. Volume loss for the temple area. You don't have to do too much other than, actually I just did it today for a patient. He came all the way from New York. He had gotten silicone injections, which I don't recommend. He did like, I think, 10 or so, maybe it's more than that, of like Vivace microneedling and did a bunch of things. He did Phenol Cross and, there is actually still a lot of volume loss. So I ended up working on it with Bellafill and it's going to look really, really good. So I didn't have to even do like much more than that right now. So I think it's going to be a great starting point for us. Julie is saying, wow, it's amazing. Yes, it is amazing, right? Look at how soft that is. That's a really, really soft, look at how soft it is. Gabe is saying he needs more Bellafill, and he's been saying that's pretty expensive. And I hear you. You guys should all understand though that I try my best to keep things very fair. There's like the process of this is like where we just have to do this for the treatment time and things like that. And, I want to get you the best possible result. I do. And it's not really about like this money portion of things, but just like making sure everything's covered and making sure everything's taken care of. But absolutely, I understand too. And then, on top of it now, like these tariffs and stuff, it's like they're like everybody's, the supply for us and stuff like that. But we're keeping our costs like I don't want to adjust it really. I want to keep it where it's at. And even when it was like COVID time, it just reabsorbed it. We haven't even raised our prices for like the stuff like for like fillers and stuff like that. Even though they keep on raising it on us, we've actually just been keeping it the same. Just so you know, it's just like to me, some of it's just like so wild what they do. And so I was just like, you know what? As much as we can possibly do, like we've been doing. So just so you know, like in fact, actually, we've tried it over and over and over again because I fully am aware of the fact, and I said it many, many times, that acne and especially scars affects people of lower economic status. And I'm not saying that in like derogatory way. I'm just saying though that like people who had the ability to go to physicians at an early on part of their life, people that were able to go ahead and do, volume and replacement early on, things like that, they don't really have to suffer from scars the way that other people had to do it. And so it's like I'm fully aware of that, and I'm aware of the economics of that, and I hope one day that it gets covered by insurance. But like currently, like things just aren't being covered. And I'll do my best still with everything I could do. The things I could do is just get you to the best possible results that we could possibly ever get. And at least it's like I could feel good and sleep well and talk to you guys and like be really comfortable about the fact that at least we always get really great, excellent results. So I was like, okay, I can feel good about that because at least it's like, there's some people out there who, this poor guy, they were, robbing him with like these random treatments that they were doing on him. And none of that stuff was working. So it's like, or these other patients that I showcase, and none of those things were working. And so it's at least I feel good that at least the stuff I'm doing is working on patients. It's like doing really well, and we're getting there, and we're getting amazing results over and over and over again. SBB is saying, once Bellafill is administered, how often should it be reapplied? What happens if it's not repeated? So good question. So this is kind of to the point what Gabe was talking about there too, basically. So essentially what happens with Bellafill is that you have cow collagen in it. 80% of it's cow collagen. And that cow collagen goes down even just after about a month or so. Okay, so it goes out, and after a month, 20% of the PMMA stays there. And now this is where the thing is that's tricky for patients. And this is where it gets tricky for people that inject Bellafill or products, and why people don't want to use Bellafill because they're very impatient. I'm talking about the practitioners. What ends up happening is it goes down, and then people sometimes could overshoot it now. They just panic, and they're like, oh my God, we got to like refill this area. We got to put a bunch of stuff in there. But what actually is that your own body starts to build collagen around it. It does expand. So you don't want to overshoot it, especially in certain areas. You want to make sure that it's in the right layers in these areas. You want to make sure that it's done really properly each time, just micro droplets in these bits. And then you're just going to wait again, and then you're going to do it again in these little micro droplets. And you don't just do a bunch in one area like that. So it's very different than the way they're taught about hyaluronic acid products, because they're told over and over. And honestly, they came over to me, and they would come over and try to, pitch me to get like this HA filler or so. And they'll say that, like inject here. And some people will say, well, you don't have to worry so much because it's always dissolvable. It's always this. And it's like, man, that's not terrible. That's not fair. That's not fair. That's not fair that like you just inject terribly and then just expect the patients to just like go through dissolving or anything else. That's not really, a good way of doing that. So I started my practice on more permanent products, actually. Really different from a lot of people. I just really knew that I had a steady hand, and I was able to do it. And I was like going to be able to do just little tiny micro droplets. And I did it. And I learned like just to always respect the products that I'm injecting. And like from the start, I didn't like now just think to myself that like la-di-da, it's like it's reversible, it's like whatever. And I just thought this is something that's a permanent product, and I'm just gonna do it really properly. And I knew that for my own face, it was really important that I look my best, and I didn't want something that was overfilled, overdone, and get like bloated or anything like that. So I made sure that I did it slowly as much as I could, and it was like to try to restore some of the scarring and the volume loss that I ended up having. So I ended up, it took a while to get there, but we were ultimately able to do that. For guys, is it safe to do pigmentation laser down there? Yes, it is. That's no problem. But for part of it though is that, you have to see, is it really worth it? because it's always normal to have hyperpigment. It's always going to be a little bit darker than the rest of your skin tone because of hormonal changes. So it's like, yes, we can lighten it a bit. It may get a little bit darker again, though, and then how significant of a problem is this? But it is, to answer your question, yes, it is possible to lighten that there. Jilliana is saying, what treatments for each session on the other patient that you showed that did 6 treatments? I think it was between 6 or 7 or so now. But that was similar actually to this patient. We did very similar process actually for her, but she had more rosacea too. So I'll pull up her photo again. Let's see where her photo went. So I think you're talking about this patient right over here. So she had more rosacea too, which is actually really important for me to manage because rosacea is this inflammatory process. You don't heal as nicely. Your collagen production is reduced. You have more oil production, and the scarring could end up looking really terrible actually sometimes with rosacea because it looks almost like patients had acne. So this was probably 6 or 7. I got to double check here at this point, but yeah, it's this was very similar process. TCA Cross, Erbium laser. I did some CO2. She had some more thickness around the edges here too, so smooth that down. Did some Bellafill for her as well. Did a bunch of steps here over the course of 2.5 years, and again, she's somebody who just wanted as smooth as she possibly could. She's actually, I believe, close to 40 or so, and we were able to still achieve that. But she's otherwise like follows exactly what I say to a T. She's so good with every single thing, and that's how we got it. Keep it saying the last doctor I went to got Subcision with cost. His cost was twice as much, and the results were not even close to yours. Appreciate it. Keep it saying. Really, thank you so much for saying that. Actually, I really pride myself on that. I know you could tell. I know when we were working on it, I was telling you too. I really do. Like, I take a lot of pride in everything I do, and it's like it's really like I know my name is on this. It's like my signature really is how I look at this. That like I want people to like have it wherever they are, that they know that like it was like done really effectively. You know, it's like this is just like it was done, and I don't want anybody, if anybody had to go and do Subcision again. It's like, you know, if they said, oh, well, his Subcision wasn't good. And it's like, I just always think to myself, I'm just going to do the absolute best possible job with the stuff so nobody could ever say that there. Daria is saying, have you ever had a patient where results were good after first session but not good after second? Not that I could think of, to be honest with you, no. I mean, actually, I think it's always been better. Like, I can't really think of anybody where it's been a problem where after the second session. Yeah, definitely can't think of it off the top of my head at all. Thoughts on ultra clear laser? I don't think it's great for scars. I mean, I think it's okay for like anti-aging purposes. I think it's going to miss a lot of scars. I think it's, it's okay. Like the concept's fine, but I could do the laser coring portion of things with Erbium or CO2 laser. I'm not sure what like utility it has. So I'm not really sure what I would do with that though. That's the thing. It's not really precise. These companies don't really have like precision when they're doing things. Does microneedling work on skin like this? Well, he tried microneedling. It didn't really work for him. So, but I'm not saying it's not going to work at all for people, but he was only 21 years old when he was trying microneedling. It didn't work for him. It didn't work on my skin too, so I'm not sure. What's the cost for one session with rosacea acne scars? Well, our prices are on our website. You could take a look and see. There's a vascular laser on there, so that's what one we're going to use, the XLV typically. So, do that, and then you can see the acne scar patients spend about $5,000 to $7,000. Anthony's saying, I know you may have answered this so many times, but where are you located? Oh, I'm in Newport Beach, California, just like 5 minutes away from the airport there. Sub is saying, I don't have deep scars on my face, but have red spots after acne, after Accutane that won't go away. So sometimes you have to do laser for those. Sometimes you may have to do that, actually. Tony Santana is saying, hey, doc, I want to go on a second course for Accutane, but I have a music festival in August that I want to drink at, and I'm supposed to see you in September. What should I do? Don't drink. I'm anti-drinking. I'm in like a whole thing about this. Honestly, it's just like I'm anti-drinking, right? Because it's just like it's terrible for your skin. Obviously, you're just you're going for a music festival. It's there, but like the skin issue, I think you just gotta pay attention to, because this even for like scar healing and wound healing, just like alcohol, vaping also. By the way, it's like also people don't really seem to understand that even vaping marijuana is inflammatory. and it's going to cause problems for collagen production. So it's like stopping all those things is actually going to help you. Just use edibles. Just take an edible. You know, I know that's probably more expensive or so, but like just do that. But like don't inhale things anymore. And then for alcohol, it's like there's like very little benefit to it. You know, it's like and there's way more downside to it. And especially when we're talking about for like scars and for acne, is a lot worse actually for your skin. What do you think of TCA paint? I love TCA paint. That's what I do almost all day long. Actually, I do so much TCA paint, so I love it actually. Let's see, I miss it. So Tony, I hope I answer your question, but like really, if you're focused on your acne, try to make sure that we're not doing too much of those. Like I know that you're trying to, you know, I'm not sure if you necessarily have to go on Accutane, but you know, strongly consider like just holding off on alcohol use. Locke is saying, what's the difference between Sculptra and Bellafill? So two different things completely, although they're both biostimulatory products. Sculptra is something called PLLA, which basically gets absorbed as lactic acid over the course of about 2 years in your system. And Bellafill has PMMA as well as 80% bovine. So 80% bovine plus PMMA. That 20% PMMA, it's been shown to be lasting at least 5 years, which is the longest lasting product. It's the only product that's FDA approved, actually FDA approved for scars. So that's another factor into like this patient who ended up doing silicone injections for his acne scars is coming to me, but like I can't do subcision on him because he had done silicone. And, you know, instead we have to do like kind of work around that whole process. But, you know, the truth is that Bellafill works incredibly well and it's the longest lasting product. It's just that it goes like people say, oh, it'll just go up and then it goes down. Oh, how's it going, Thailand? Good seeing you on too. So this is actually after 5 sessions for this particular patient over the course of a year. And we had to do a few different steps really. He was trying to really shoot for more of like that complete polished look and as much as he possibly could. He was just trying to shoot for like the best he could possibly do. And here we are, you know, look at that. Pretty cool. And then when he came in this day, I ended up doing a bit of TCA Cross and laser here for him. I never see much results with microneedling either. Actually, I'm going to show you guys on my page. I had a patient, he's letting me share it. He's letting me share it actually. You have to see this. It's ridiculous. I think we're going to show it tomorrow or so. But they, you know, he has such deep, thick scars, and he went to somebody, and they basically all the results, it turns out, were just actually after the microneedling session. And he was shocked by this. He was so stunned that like he came to this person, this practice as a dermatologist, and he went there and assumed that like these microneedling results were amazing, and maybe they had some like amazing technique apparently probably for their microneedling. And he went over there, and the photo that she took was immediately after she did the microneedling. And that's when he realized like it didn't look anything like my skin, and it's like it went down after a week. And that's such an unfortunate story. That's really unfortunate. This is a result 1 year later for this patient, 1 year later for him. And so it's like, here's how you could showcase that. Like that's the real type of way of doing it. You don't showcase like things like 1 week, 1 day later, or the same day. It's wild. He definitely got there. That's amazing. Yeah, Thailand, he got there. Like it's pretty awesome. I mean, you were talking yesterday about like, you know, social, mental wellness. And this is a patient that like just felt like he wasn't as confident because of his scars. And this is another thing, actually. I feel like this is like something that people say, oh, it's not noticeable. I have worse scars, blah, blah, blah. And it's like, I'm not saying you do. I'm just saying that people out there would say that sometimes. And it's like, who's like competing? It's just like to him, he just wasn't the best that he possibly could have been. And now he is. You know, now he's really getting there. And it's like, now this is no longer holding him back. His career is taking off now. You know, he's just graduating right now. And it's like, he's like set. He feels much more comfortable and confident as he's at work and things like that for everything. And it's like, it's pretty awesome. You know, I remember at the beginning of his journey when he was starting his internships and stuff like that. And now here he is here and fully confident person. And it's like, it's awesome to see, right? You know, it's just like a really cool trajectory for somebody. And like I was saying, it's like shifted now. This whole life is now just shifted. He no longer has to have this buzzing in the background here. He just feels comfortable and confident and happy in his life, and he's been able to achieve what he wanted to achieve there. Gabe is saying smoking is bad. Yes, Gabe, smoking is terrible. And Gabe, I was talking to you about it before, but also with you know, whey protein. I know you work out a ton. Whey protein, all that stuff. That's whey has dairy, you know, and it's going to cause more inflammation in your skin. It's going to actually cause more oil production. So I definitely do not recommend that also. Really cut back on dairy too. Link is saying, hey, I'm late. What was done on this patient's face? So this was a few steps. We did TCA Cross, we did ablative CO2 laser, fractionated CO2 laser, as well as Erbium laser. I did subcision for the patient. I also did some Bellafill for the patient. I did a few times actually of laser, TCA Cross, and also with more laser. And one time I showed his result, one of his earlier results, and he came on. I don't know if he came. He's in Arizona, so a different time zone. But every once in a while he pops on, and it was actually I didn't even realize he watches this. He's like, yeah, I'm on here every once in a while. So it's kind of interesting. But sometimes you'll see that like I post someone up there and like they're in the chat there. Sculptra saying, will Tretinoin work for rolling scars? Probably not so much for rolling scars. Actually, it could help a little for these kind of scars, like ice pick, boxcar scars. It could shrink them a bit, so it may help a bit for that. It may be something like that, actually, not so much for rolling scars. Challenge saying, I definitely feel him on that. I'm so glad there's amazing options to get people here, hoping to approach a similar place someday if I can. Yeah, it's pretty early for you. You're already pretty, it's getting there pretty quickly. I think you already have a pretty robust collagen response, to be honest with you. I think it's going to be really awesome. And this patient really also, just like yourself, followed exactly what I said, did sunblock, made sure that, he's doing everything I said to do. And it's like no pigmentation issues, nothing. We just kept on going at it and chipping away at this. And it's like, here we go. That's pretty cool, right? It's pretty cool. And it's like, actually, today was like, I had a lot of follow-ups today, a lot of stuff. It was actually a pretty great day. Actually, I had a lot of cool patients that I was seeing after a while, and like you can see where they were at. And I was like, okay, you can see where that journey's at. Saving up to see you at the end of the year. I don't trust anyone in my state. Appreciate you. You know how to book a consultation, though. Do it at drqazi.com. And schedule the schedule now, though. Honestly, summer is really busy. Fall, winter times are busiest, though. So try to schedule it now. And I'll tell you something just so you guys know, I'm almost done for the night. But I just told my team right now. So we are really booked up ahead of time. But actually, what it was doing was I've been having longer days and things like that. And I'm gonna be actually not having as long of days for myself now, just so you guys know. So that means less room for consults, less rooms for potentially scar patients as well. My priority is going to be more towards patients like Thailand or so, people that or Gabe who've been doing it, that need to do second steps, need to do other treatments, so I can finish kind of more of their journey also. And so just so you guys are aware, I kind of told you about that last year. That's going to be coming to that point, and it's kind of at that point right now where it's kind of I really want to get it to that. It's my team, we work very, very well together. We work really, really hard. It's an amazing team, amazing coordination. But we also we need to make sure that everybody is just all of our patients could be able to see their second step and things like that. And I don't want to delay their treatments or anything like that. So I got to make sure that patients continue their journeys and the ones that I have can do that. So I'll work on that, just so you guys know, it's coming really, really soon. But you may hear now more often that we just may not be able to squeeze people and do things as much as we were doing before. Just to be totally frank and totally honest, I just want everybody to know about that, so it's not a big shock when my team starts telling you guys about that. Because normally I do try to do it. I do try to fit people in, try to get things going. And even some Saturdays I was pushing people in there for if they needed it or so, because they're coming from out of the country or some things. But it's really, really limited. I'm definitely Saturdays are just not even really happening at this point now. And so it's just so everybody knows, just so you guys know. But yeah, I would just, it's awesome otherwise. And I want to get people to finish their journey that have been doing it with me. I want them to kind of, to have it like this. If they're trying to shoot for that polished look, if they're here to get everything, done for them, I don't want to really stop it on them. So that's what I want to do. I want to make sure that they're put in the priority, and we could put those guys in so we could see them in a timely manner, and we can keep getting awesome results for them. Let's see here. Alpha God Body is saying, when I see the CO2 lasers make contact with the skin, it looks as if the skin is getting tighter. Yeah, it contracts a bit there. It does contract a bit right there in the surface there. You're right. Indoors as much as I can, and I'm loving my LTMD if I'm out. Also, I'm glad you like LTMD. I never really loved it, to be honest with you. But I'm glad that other people do. I like the mesoaesthetic ones. I like those ones. And also even some of the I've been trying some of the Korean brand ones, and I like some of those ones too. I don't know. I didn't really love LTMD that much, but a lot of patients who have acne, and they say that they really like it. I actually just tried beef tallow yesterday, by the way, or tallow, whatever you non-Chicagoans say. I actually just tried that, and interestingly enough, I'm almost positive there's a high concentration of vitamin A in there. I gotta look into this a little bit more. I'm actually really curious about that. It feels just like tretinoin to me, and it's just like mixed with a little bit of moisturizer, I think, or so. But like, I'll keep on updating for you. I actually just tried it yesterday. It does feel like it's like vitamin. It just feels like tretinoin to me with a little bit of moisturizer, maybe or so. That's kind of interesting to me. So I'm not entirely sure what to make of that. I know it says that like beef tallow has vitamin A in there, but it feels like maybe a little bit more than maybe we realize or so. I'm not even sure. At some point, like I want to get like the concentration of how much vitamin A is in there. Thailand saying Korean ones used to break me out, sadly. Ulta fortunately doesn't break me out. There was a brand actually I saw. Well, I put it up on my story one time because I was trying it on. And I don't think it was breaking people out. People did try it. I'll give you the name of it tomorrow or so. But I remember we were trying some things out for some Korean sunblock. And it was actually really good. It came out really, really nice, actually. What's your cleanser and sunscreen of choice? So I use when I shave, I use actually an oil-based cleanser. It's another one. What's this thing called? Shushizo or something like that. I gotta get these names down. I'll give it to you later though. But it's like this oil-based Korean sun. I've told you guys it before. Maybe someone out here remembers. And then I just use a gentle cleanser. I just use Cetaphil gentle cleanser. And then sunscreen, I mostly use Miso Aesthetic sunblock. Usually, that's usually my go-to. Sometimes if I'm grabbing something, I'll grab like that one Korean one I was talking about there too. Which was like this water-based one. But the problem is that the label got worn down, so I can't even remember what the brand was anymore. So I got to take a look at that. Actually, it's kind of interesting. They always try to send me stuff, and I just buy it, and then I kind of forget what these things are. But I have to pay attention to it a little bit more. So I'll see. Let's see here. Do you think at-home Dermapen will significantly improve rolling pitted acne scars? I do not think so. I'm not a fan of anything rolling. If you want to do something at home, consider stamping. You could take a look at Banish because there's a stamping device. Stamping is better than rolling. So that's better. So that's what I would say. Do you have any realistic Phenol peel results? Yeah, I have it on my page. I showed some. Actually, I have a really cool one coming up. I'll give you a sneak peek. He's still healing right now. You want to see a sneak peek of that actually before I come off? He's healing right now, but I'll show you something here. It's really cool. He's very, very severe scars. These are from his selfies that I'll show you actually from his photo, like proper photos when he comes in. But you'll take a look and see. Look at this. I'll show you something here. Where's that thing? So let's see. I'm going to try to find. I was actually not planning on showing this because he's still healing. Obviously, he's really red. Last time I did a follow up there, and still very, very red. But look at this. It's going to be awesome. You can see this. So I did Subcision for him, and then we ended up doing the Phenol. So that middle photo is after Subcision there. So you could take a look and see that. So this is actually, he has very severe scars, very, very severe scars. One of the nicest people ever too. So many patients are, but like he's he's a very, very amazing person, amazing character. And we had a long talk. Actually, it was interesting. Like a whole Friday night one time, I was just talking to him before I did the second part of the Phenol because it's just like he was really anxious about some things, and we just talked it out. It was really interesting. It was like a lot of suffering from his acne and his scars. And it's going to be an amazing, amazing thing that when we ultimately solve it. So this is actually good because I want to showcase something for you guys for this. This was with Phenol. We did Subcision and Phenol, and we still have volume loss. And that's the thing. It's like these results that don't show the volume loss. It's just not true. You still are going to have volume. He totally understands that. He totally understands that he has volume loss, and we're going to do volume replacement. When I see him again, that's when we'll do more photos and we'll showcase where exactly it's going to be. It's going to be way less red that day, and then eventually I'll end up showing you guys what his in progress is. He's somebody that lets us show like the whole journey there. Actually, he's such a nice gentleman, and he just wants people not to suffer anymore. It's actually amazing. It's just like one of the these people a lot of times, as I always say over and over, people have told you the wrong things. They keep telling you that the world is terrible, the world is evil, all this stuff. There's so many people out there who are really good people who want to help people. There's a whole group of people like that, and there's way more of us. I really put myself in this category. There's way more of us than you may expect. There's way more people. There's like a whole community out there of people that were just doing MP3s for free. They were like just burning it and like burning their disc and putting it up there, and they were doing it for free, And it's like there's like a lot of cool people like that. They were doing that. Like they were doing all that stuff. They were doing like like all that, and they were like helping people out. And I guess I just said burning MP3s is helping people out. But like, I'm just saying there's a lot of people. Look at, like, if you look at like the whole Linux community out there, like there's like looking at this, there's all this software out there. People don't even know. It's like, there's all this software out there for people just to explore. And like people are doing it for free. It's like open source for free. And it's like, you could just go look under the hood and see that like they're not stealing your data. They're not doing anything. They just wanted to build something and help people out. And like they did it. And there's a lot more people like that than you may expect. And it's actually interesting. A lot of the patients that I end up getting to showcase and things like that are like that actually. They're like these kind of people that just want to showcase to people and want to like they want to like explain, like share to the world what they've done, because they don't, that other patient I showed, I'll show you him again. He like said he doesn't want anybody to be bullied the way he was, he saw people being bullied and suffered. He doesn't want people to suffer the way he suffered from his acne and his scars. And this poor gentleman had done 10 subcisions, CO2 lasers. I can't remember how many. He spent so much money. And it was just the saddest thing, actually. I don't know if you're on here right now tonight. I know you weren't planning me. You didn't really expect me to talk about it. But really, it was it was an interesting thing. It was an interesting type of thing that like you just talk about it, and it's like he really genuinely just wants to help people, so that people just see that like this is what you could do, and it's like, we're going to get there. It's still early on, of course. Like I know for sure it's like we have work to do. There's no question. But like where his point was, after 10 subcisions, like, so that first photo is after 10 subcisions and a bunch of like lasers and a bunch of Morpheus 8s and a bunch of other stuff that these guys were doing on him. This was just ridiculous. And it's unbelievable, right? It's honestly so terrible, actually, when you actually look at that. It's so terrible. And it's like, I don't know why someone would actually think to themselves that it's ethical and that they are physicians and they did something to someone like this. They did 10 subcisions on a patient like this and they got that result still, at that first result right there. And they're saying to themselves that this was something that they should still do. And they're still in business doing subcisions on people. It's wild. Talon's saying the community is very kind. I hope to inspire confidence to others too. I'm always trying to brighten super negative subreddits to start. It gets crazy online with negativity. Reddit acne scars is a nightmare. There's a lot of people that come from there and then they move on in life and they're very, very happy. And the people that, sometimes just can't afford these treatments, or just like it's difficult to kind of continue and things like that for them, or they've gone to places that did something like this. Like if this was this patient and he's a very positive person, but if he's somebody who did 10 subcisions, I would see why he'd be upset. I would see it. I would get it. I would understand that. But like there's people out there that like they're still strong, they're still able to like push through it, and then we could still end up getting them an excellent, amazing result ultimately. It's just tough though, because it's like they went through all this process, and these 10 sessions of subcision. Imagine that, Tyler. Imagine that, all you guys, 10 sessions of subcision, and that's the result that they gave him after that. I mean, I can't, like, I would just hang up. I would be done. I wouldn't do it. Like it would just be like over if this was like after 10 subcisions and like a bunch of lasers and all that stuff, and that first before photo is what these guys had left them with. I think it's really terrible, actually, right? Like that's just a terrible situation. So that's why people are like upset. That's why there is so much sadness out there. So it is important. Like that's why I like this community. But go out there and like kind of just like help people, and just like when you get to a place where you feel comfortable doing it. Maybe you can't do it. Maybe you want to move on from it. But if you are somebody who's like able to like talk to people and before they like get so depressed and so worried, and give them a bit of hope and confidence in like what they could do, like wherever they are, because I'm not going to be on every platform. I'm not capable of going everywhere, but like try to help them out and try to see like what their problem is. You guys kind of know what the things that we do, and you don't have to like say that I'm doing it or anything like that. Just like explain that like this is the stuff that like makes sense. Don't like accept that someone's saying that like do a bunch of microneedling or do this or do that. Like say, hey, like maybe like these scars need something else, and it needs like another way of doing it. But like I do agree that there's a lot of toxicity out there, and it's unfortunate that people got really dark sometimes. They went through a dark place over time. But yeah, as DFIT saying is there are good people out there. There's actually way more good people than people say there are. There's actually way more people, way more. We're fully aware of the bad people out in the world. There's a book, it's called The Sociopath Next Door. It's like estimated in this book, it's like 10 to 20% of the population is sociopathic. And it's like kind of interesting, actually. It's like an interesting theory, because it turns out actually what the book's thesis is basically that a lot of these sociopathic people actually become very successful in finance or even in medicine. I'm around a lot of these sociopathic physicians all day long, actually. Well, I used to be when I used to go to those meetings and conferences and stuff like that. And they like literally are just like terrible human beings. They lack empathy. They just have zero understanding of suffering. And it's like, just like they're you know, there's so many people like that. And the thing is that they can become successful in this capitalistic world, this terrible system that has been created and designed by these sociopaths and these psychopaths. You know, it's not a natural way of doing things. A natural way is actually a community. It's actually helping. It's actually, we get joy out of helping. Look at like kindergartners, like my son, he's like helping out like a person in his class who was sick, and like he's giving things and he's doing all these things. And that's like a natural instinct to do. But there comes a point, like whatever age it is, I don't know when it happens, but there's like a point where it shifts, and it's like, what do I get out of this? What am I going to gain out of this? How much money are we going to get out of this? And it's like, that's when like everything gets like destroyed. That's when the stuff is started getting, it's really started to ruin us as a system. And so that's why I'm saying that, like, really, there's a lot more people that want to actually just work together in a community, a lot more than people expect. So that's my last thing for this week. I will say I did a lot of different things. Actually, I showed a lot more people than I was planning on doing, but I was kind of just like, you know, a lot of good chat stuff. A lot of people were on here that I want just to kind of go through with this. And I do want to have like everybody just see like just that process and that progress, and like go through the whole thing. And maybe just like you guys can think about things a little bit there. Like, here I am in this world, and it's like, you know, it turns out that you're not as alone as you think. Turns out there's a lot of better people out there than you may think. Turns out that there's a lot of treatment options, a lot of better treatment options than you may have expected. You know, it turns out there's a lot more options. And it turns out that, like, it just, you know, we just have to be patient. We have to go through the process and trust it. And ultimately we get there. And it's like, and when I get there, it's like our patient, where was our patient over here? Look at him. After 5 sessions, super smooth skin, and we got there. Thank you guys so much. I will see you again on Monday. Feel free, please give me a follow, and you know, hit likes. And then also, if you could, if you want to schedule a consultation, go to